Assalamualaikum and selamat sejahtera to everyone. We are from Group 1 and our project is titled Evaluating Data Mining Techniques for Predictive Modeling. For this case study, we selected the healthcare domain, specifically focusing on diabetes prediction using patient data. Our team members are Arni Natasha, me myself, Nur Amira Balkis, and Nur Ilhami. We will start with part A, evaluation of data mining techniques for diabetes prediction. So let's start with what is diabetes. To begin, let's briefly explain what diabetes is. Diabetes is a chronic medical condition where the body either cannot produce enough insulin or doesn't use it effectively. This causes high blood glucose level, which if unmanaged can lead to serious complications like heart disease and kidney failure. There are two main types. Type 1, the immune system destroy insulin producing cells, and type 2, the body become insulin resistant and doesn't make enough. Early detection is vital, and this is where data mining comes from. What is data mining? Data mining is the process of extracting patterns and insight from large dataset using machine learning and statistical techniques. In healthcare, it used for disease prediction, patient risk assessment, outcome forecasting. In our case, we use data mining to help predict whether a patient is likely to have a diabetes based on their health measurements. For this project, we have chosen three algorithms, which is logical regression, random forest, and also decision tree. For each algorithm, we will tell you the strength, the limitation, and also the impact. Let's begin with strength. Logistic regression is simple and fast. It is also very interpretable, making it ideal for medical professionals who wants to understand the factors influencing a diagnosis. Decision trees are great for handling both numerical and categorical data. They generate easy to follow rules, which make them useful for non-technical staff in clinical setting. Meanwhile, random forest is an ensemble method that offers high accuracy and better generalization. It reduces overfitting by combining many trees and can handle noisy data. However, each technique also has limitations. For logistic regression, it assumes a linear relationship between variables. It may not perform well if uh, a pattern are complex or nonlinear. Meanwhile, decision trees are prone to overfitting and can be unstable. Small changes in data can result in very different trees. Random forest, while accurate, it is less interpretable and requires more and computational resource. It is harder to explain its prediction directly to patients or clinicians. For impact, logistic regression provides transparent results. Clinicians can easily explain why a patient is at risk. This support evidence-based care and improves trust in prediction. Meanwhile, decision tree produce clear rule-based output, making them useful in automated triage tools or patient screening system, especially where quick, transparent decisions are needed. Lastly, random forests deliver high accuracy, which is useful in hospital back-end system for prioritizing patient care or allocating resources. Even though it is less interpretable, it is powerful for large-scale analysis. That is all from me, and I will pass to the next person, which is Nur Amira Balkis. Thank you.
Assalamualaikum. My name is Nur Amira Balkis binti Muhammad Isa and my magic number is 073750. Now I will discuss about data pre-processing and feature selection for diabetes prediction. But first, we will go to data pre-processing first. First, we take a tricky pre-processing challenge. One is missing value. We found several impossible zero value in blood pressure, skin thickness, and insulin reading. Rather than using this misleading zero, we replace them with mean value and estimate based on similar patient. The second one is normalization and standardization. We notice it has many different scales, like glucose range around 18 to 200, BMI range from 20 to 45, age range from 20 to 16 years old, and diabetes predictive function, minimal value was zero point 0.1 to 2.3. So, we apply Z-score standardization and min-max scaling to bring all features to a comparable range. And the last one is outlier detection. By following the dataset, we notice some potential problematic value like very high incident value like 846 and unusual high BMI like 45.8. So the solution, we use IQR method with medical content unbinding to create more robust feature without completely removing data point. Now, we will go to a feature selection for diabetes prediction. Based on dataset, likely correlation ranking, we have 8, which is glucose, strong positive correlation with diabetes, number 2 BMI, number 3 age, number 4 diabetes predictive function, number 5 pregnancy, number 6 insulin after proper imputation, number 7 skin thickness, and number 8 blood pressure. After we check and evaluate this model and feature, we get to see the accuracy, classification report, and confusion metric. This bar graph titled Model Accuracy Comparison and ROC Curve Comparison show the performance of three machine learning model, which is logistic regression, decision tree, and random forest. Based on their accuracy score after training them on the diabetes set that I said earlier, we have 8 features. So, number 1 is a logistic regression, which is graph summary is logistic regression has a 75.3% accuracy, best at correctly identify non-diabetic cases like case 0 recall 0.8. The second one is decision tree, which is it has 74.7% accuracy, best at detecting diabetes cases, which is class 1 recall 0.73. The last one is a random forest, which it has the lowest accuracy which is 72.1%, the lowest overall performance. It has the most conservative in predicting diabetes, which it has a fewer false positive than decision tree. Our data preprocessing improved the model in three key ways, which is it fixing missing value boost accuracy by 5 to 50%, better feature selection increase sensitivity by 10 to 20%, and the last one is standardization help certain algorithm work better. This improvement mean more accurate diabetes prediction and better patient care. Our work has two main benefits in clinic, which is better patient risk grouping, which is allowing for personalized treatment plan, and the last one is clear explanation of risking factor, which is helping patient understand which factor they can change, like BMI and glucose level. That's all from me. Thank you.
Next, let's move on part C on steps that we would take to ensure the stakeholder trust and adopt the data mining. We choose logistic regression because it is transparent and interpretable. This is important in healthcare domain where doctor and medical staff need to understand how this model work and make the decision. In our model, we can clearly show features such as glucose level, BMI, and age contribute to the prediction. This allows healthcare such as doctor and medical staff to trust and explain the result to the patient. Second, clinical validation and stakeholder involvement. Our model achieved the highest AUC score of 0.753 compared to the decision tree and random forest. This shows it performed well and it is reliable. We also aim to involve the medical expert in reviewing on how the model works so it fit the clinical needs and can be improved based on the feedback. Third, integration with clinical system. The model can be implemented into patient triage or risk assessment system to help doctor make decisions rather than replace them. It an easy use interface that allow non-technical healthcare staff to use the model with confidence. Next, ethical consideration and challenge during the implement process. First, the data privacy and security. We need to protect the sensitive patient data using anonymization and secure storage and comply with healthcare regulation. Second, bias and fairness. We need to ensure that the model is not biased against specific groups such as gender or race, and conduct fairness audit and address algorithmic bias. Third, risk of misuse. We need to prevent the over reliance on prediction. Model is a support tool, not a diagnosis, and educate user on how the model limitations, such as underperform with unseen data. Fourth, false positive or negative. We need to consider the ethical implication of error. First, false negative, which may delay the treatment. Second, false positive, which may cause unnecessary stress and medical examination. That's all from us. Thank you.